All right. Hi, everyone. We'll go ahead and get started now as people continue to shuffle in. I do think that the previous event is running a little bit late, so we'll have people shuffling in the next few minutes. But hi, everyone. Welcome to the MD PhD admissions panel in Translational Medicine Day 2021. Just to briefly introduce myself, my name is Rachel, and I'm this year's TMD co-chair. And I wanted to give a brief intro about the MD PhD panel before we dive into our panelists. So the MD PhD route is a great option for those of you who are looking to get that deep training and experience in both research and clinical settings. I think it really gives you a unique outlook and advantage in having a career as a physician scientist. And so to help answer all your questions about what programs are like, what you can do with an MD PhD degree, and just what's expected of you as an applicant, as a student, we have an incredibly knowledgeable set of presenters here today from institutions from around the country, and we're really excited. So I will turn it over to Bethany, who will introduce everyone and get started.
Okay, hello everyone. Welcome to Translational Medicine Day 2021, and this is the MD PhD admissions panel. My name is Bethany Yuan, and I'm one of the co-sub-leads for the panel, and the other co-sub-lead is Varsha. Varsha, do you want to introduce yourself?
Hello, I'm Varsha. Like Bethany said, I'm one of the MD PhD panel sub-leads.
Yeah, so we'll be the hosts for today's panel. And yeah, like as a reminder, the section will be recorded. So if you don't feel comfortable being in the recording, please feel free to turn off your videos. And yeah, let's get started. So I'm very excited to introduce you to our 6 panelists today. They're Dr. Walensky, Dr. Engler, Dr. Mott, Dr. Nayak, Mr. Maker, and Dr. Sadawi Kanefka. Let's ask them to introduce themselves first. Dr. Walensky, do you want to go first?
Sure. Hi, everyone. My name is Lauren Walensky. I'm a professor of pediatrics at Harvard Medical School, and I work as an attending physician in pediatric oncology at Boston Children's Hospital and run a cancer chemical biology lab at the Dana-Farber Cancer Institute.
Okay, thank you very much. Dr. Engler.
Apologize for the delay. Had to find the mute button. Hi, everyone. My name is Dr. Adam Engler. I'm a professor and vice chair of the Department of Bioengineering here at UCSD. I am also, with another hat on, the associate director for our MSTP, Medical Scientist Training Program, or MD PhD program here at UCSD. I specifically focus on admissions, as well as act as a liaison between our students that are in their PhD portion of their training in the engineering school and the program as a whole. So I'm happy to entertain questions about that. My lab works on cardiovascular and cancer mechanobiology.
Sounds cool. Dr. Mott.
Hi, everyone. I'm Justin Mott from the University of Nebraska Medical Center here in Omaha. I'm an associate professor in biochemistry and molecular biology, and I direct our MD PhD program. I'm also the chairperson of the curriculum committee for the medical school, and my research focuses on liver cancer.
Okay, thank you. And I believe Dr. Nayak is not here yet, so let's move on to Mr. Maker.
Hi, everyone. It's so nice to see you guys virtually. My name is Yadra Maker, and I'm a MD PhD student in the combined Baylor College of Medicine, Rice University program. I've completed 2 years of medical school, and now I'm in my 3rd year of the MD PhD, which is also the 1st year of graduate school here. So completing a bioengineering PhD in Dr. Rebecca Richards Cordum lab, and I work on point of care diagnostics. Thank you.
Thank you. Okay, and last we have Dr. Sadawi Kanefka.
Thanks so much. Thanks for inviting me to the panel. I am a product of UCSD MSDP training myself, and then I stayed here for residency training in otolaryngology, head and neck surgery, and I am midway through that in my second year in a lab. I'm working in Morse Cancer Center under the guidance of Dr. Silvio Goodkind in precision immuno-oncology therapies for head and neck cancer.
Okay, thank you, Dr. Sudali Konevka. I think that's all the panelists we have today. And today the panel will be divided into two portions. The first half would be me asking pre-prepared questions. And while I'm asking these questions, I'll also drop them in the chat so you can refer to them. If you come up with any questions during our conversation, you can either keep it because the second half will be Q&A, and you can ask them directly, or you can private chat me so that you don't interfere with the conversation. Okay, and I'll just stop sharing right now so that we can all see each other's faces. And let's get started. So the first question would be, what does a typical day in your life look like? So we don't have a particular order, so feel free to jump in for anybody.
I'll go ahead and start. I feel like I'm the lowest on the tier of where everyone's at. So as I mentioned, I'm a first-year graduate student, and so my daily life kind of revolves, of course, around my research. Most days I wake up in lab and I'm balancing things like, setting up experiments, but also, going to meetings and making sure I have everything in order for being successful in my research. It's really fun and multidisciplinary. So oftentimes I'm working with clinical collaborators and also working with other graduate students in the lab. And so it does require me to wear a lot of hats, but I also enjoy wearing a lot of those hats. And so that, I think, is kind of what my day looks like from 9 to 5, 9 to 6. And I will say that one thing that does change, and I'm sure a lot of the MD PhDs will agree in the room about this, is that once you start graduate school, you have a little bit more work-life balance. Medical school is a little bit more rigorous. So that has been a nice transition from finishing 2 years in medical school, where I kind of, was working pretty hard. Even when you'd go back home, you'd have a lot of studying to do, and you'd finish clinics and you'd still want to be, making sure you're on top of things. But in grad school, I feel like I've been enjoying a few more things. I do rock climbing or go out, hiking more often. And so I'll usually fit in a visit to the park or hanging out with some friends outdoors, socially distanced these days in the evenings. And that's kind of what my day looks like.
That sounds really cool. Can anybody still remember what their day used to look like?
So I think the student perspective was really helpful. I can still recall the differences between the two, and not only does the day change, but the thought process changes. Sort of everything changes, including even your friend group. And that's, I think, one of the challenges for the MD PhD program, is having the medical students that you've worked so hard next to continue on to their clinical clerkships, in our case at least, while you're moving into the lab. The typical day of somebody who's gone through the program, as I have a number of years ago, it actually is one of the things that draws me to it, because I don't know how to answer the question. Each day is its own day and is different, and there are brand new problems that I have to approach with creativity. And sometimes those are research problems, and sometimes those are in teaching. Very often it's in interpersonal interactions, and how can I help somebody with a challenging situation in conflict resolution or whatever it might be. And so I interact a lot with students. I think mentoring and teaching is one of my favorite things about my job. And to make time for that, I haven't seen a patient since 2005. I know this is very different than a number of other physician scientists. I still know where my stethoscope is, but I can't remember the last time I used it. So that's my day.
Yeah, it very much depends on what day and of the week and month that you catch us in. My life is, a lot of times people ask physician scientists, how do you balance all of this and how do you do all this at once? And my answer is that you you don't. You really do one thing at a time, because everything that you do requires 100% of your focus, right? You can't take care of children with leukemia and also work on a grant submission, on the same day, right? These are things that are just not possible. When you're taking care of a patient, that's your 200% attention, and when you have to get a grant submitted on behalf of the MD PhD program or on behalf of your own laboratory, that's also 100% of your attention. So, when I'm working in the hospital, I will be working in the hospital from dawn until dusk, and when I'm working in the laboratory, it's similar. So it really depends. But again, like one of the things that Justin said that's so wonderful about this is that it's impossible to get bored. Every day you're doing something different, and even though you might be doing something different, they're all the things that you love to do. So for me, working with students in the laboratory and thinking about new problems and how to solve them, or going in the hospital and trying to be the advocate for saving a child's life and doing the things that need to get done to provide the best care. And then, as director of the MD PhD program, selecting and meeting and training and advocating for the, all these incredible students that are certainly well worthy of your time. So it's just kind of like an abundance of wonderful things to do. So I have a very kind of overflowing positivity feeling about the physician scientist career, because I think it can be anything for anyone and what they want it to be, whether you're still seeing patients, whether you've stopped seeing patients, whether you're working in an academic setting or a pharmaceutical setting or a government setting. I mean, it's really just such an abundance of opportunities.
But just add to that, the word that I would apply to what Dr. Walensky was saying is compartmentalization. I think that I try to compartmentalize as best as I can and pay 100% of my attention on a particular task at that time. So today, for example, it was my NIH study section that I was a part of, and we were talking about clinical applications or preclinical studies of cardiovascular therapies. So that was up until about an hour ago, my entire focus for the day, and we put in a lot of preparation for that, but it's different every day. So next Monday, I'll be working on our clinical trial. So, it varies day to day, and it's great.
Of course. I'll jump in and add one other component, which I know everyone has, it's part of everyone else's day, but hasn't been mentioned. And that's just that life happens in the meantime. And as you go along, I think I'm far enough along now that I know that with each subsequent stage in training and then ultimately career, you only get more and more stuff and more responsibility. And the life happens part. So I have 2 kids, an 8 and a 4-year-old. So some of you guys will go on for training and you'll have families. The right time to do it is probably when it happens, is the advice that I got 8 years ago. And that's been true. So, that gives some stability to the day and some routine. But it comes out of somewhere. So sometimes there's like, you have to meet these deadlines. And so that comes out of sleep sometimes. But yeah, that's a component. And then I guess for the if you're going to do the residency training part, a lot of the focus is on really executing the experiments quickly, efficiently, and then building networks of collaborations that you can take forward. So that's an important part for my days.
Cool. It sounds like MD PhD life is very exciting and every day is different. Okay, let's move to the next question. Describe the MD PhD program you attended or you run. Is there anything unique about your program?
I'm happy to jump in on that. So I went to the Johns Hopkins University School of Medicine MSTP program, and it was just a phenomenal experience. And a lot of the experiences that I had and enjoyed as a student, I really kept in mind when I came to take over the MD PhD training program directorship at Harvard and MIT in 2013. I think that one of the unique elements of the Boston program is its partnership with MIT. So students that come to the MD PhD program can really get their PhD in just an unbelievable broad array of basic social science and engineering disciplines across both institutions. I guess the other thing that's very powerful about the Boston environment is that it's become a real hub of biotechnology nationally and globally. And so many of the students whose PhD theses are successful can really contemplate, the translational potential of their PhD research in the form of forming new companies and having their intellectual property licensed and translated. And then finally, there's just like so many institutions, in the neighborhood. So, you have all the different hospitals like Brigham and Women's Hospital, Mass General Hospital, Boston Children's Hospital, and then just so many different, research institutions as well, like Dana-Farber and the Whitehead Institute and Broad Institute. So it's really just such a broad spectrum of opportunities and institutions that allow you to really dive deeply into any area of interest, but also to, cross disciplines and make new relationships between labs and institutions based upon your own creative ideas.
So I'll jump in as well and describe UCSD's training program, because I think that we have some unique aspects, and given our target audience, our present audience, I think that's probably most applicable. And I think one of the unique aspects of San Diego in particular is the wealth of biotech that we have and other institutes on the Mesa here. So when you're in our training program, you're obviously in UCSD School of Medicine, but your PhD component of that training program can be done at any number of institutions. So it is not just UCSD proper, but you can have mentors who are training you and in whose lab you do your thesis research. And they can be from the Salk Institute, the Scripps Research Institute, Sanford Burnham Previs Medical Discovery Institute, La Jolla Institute for Immunology. So, we also have joint degree programs with San Diego State University. So you can really work in any of those different areas. We also are a participant in the OxCam program, which means that you can do your PhD at Oxford and Cambridge and then come back for your medical training. So I think flexibility is really important in an MD PhD training program. And I think that we are able to provide that flexibility, especially on the graduate training phase, given the wealth of opportunities around us here on the Mesa.
Yeah, I think I'll echo and transition a little bit to the Baylor Rice program. I will say that my top two choices at the very end were UCSD and Baylor Rice. So Dr. Engler has definitely sold me on a lot of those, a lot of the different institutions that I could have been a part of, but I ended up choosing Baylor Rice for other reasons, and mostly was the one particular PI that I hoped to work for, and I ended up working for. And so particularly within the bioengineering program, so the way it works here is similar to the Harvard MIT program. You can choose to do a PhD at either Baylor College of Medicine or at Rice University. And particularly the bioengineering program at Rice is very strong, and I was very excited to become a part of Dr. Richards-Cordham's lab. And similarly, because of the fact that Rice is in the largest medical center in the world, the Texas Medical Center, we have an immense number of clinical collaborators. And I think that is one thing that I think you'll find a lot of really good MSTP programs. And so I think Baylor and Rice really stand out in that way as well. And I think another unique thing that is special to the Baylor Rice program is the number of, because it is the largest medical center, when you're doing your clinical rotations, you have so many different hospital systems that you actually get to integrate with during your clinics. So I'll go to Baylor St. Luke's, which is a private hospital and has slightly higher resources and a different patient population than Ben Taub, for example, which is the county hospital. And you're seeing some really tough cases there. A lot of people with cardiovascular problems, kidney problems, who are unfortunately homeless or have other psychiatric issues because they're on drugs. And so there's a lot of variety in terms of the patient populations that you get to see here as in the Baylor Rice MSTP program.
So at the risk of having you focus too much on me, I want to take things backwards a little, half of a step. And for the students, if you want to see what's behind me, if you either switch to speaker view, or if you pin my my video, I think you'll be able to see it a little bit better. A broad overview of our MD PhD program, which I don't think is starkly different than most. We bring our students in in the summer before their M1 year. When they do research rotations and then they enter medical school, they complete what we call phase 1, which is the preclinical curriculum, and then switch to their graduate years. The time in graduate school is usually 3 to 4 years for us. It's 3.8 years, and we don't divide our students into 0.8, but that's the mean. Once you've finished up your defense, you go back to phase 2, which is the required clerkships. These are 6 areas of medicine we think every general medical student should be trained in. And then in phase 3, you enter into career exploration as well as the residency prep phase of your medical training. So this is kind of an overview. It spans 8 years, 7.8 on average for us. And it's a real investment. If you want to do this, if this is a driving force behind you, these 8 years go by. Some of them are very hard. Some of them are quite enjoyable. If you're not fully invested, it's probably not worth these 8 years, to be totally honest with you. You've heard from the speakers, we all want you. Absolutely, we're talking up our programs. We're excited about being here to see you. We definitely want you to consider our programs, and that's true also for me here in Nebraska. I would love that if it's right for you. So I will say one of the unique things that we do is at the very beginning of our summer research rotation in the first summer, instead of putting you straight into the lab, we actually put you into a mini medical school. We have a 2-week course that is cadaver-based that covers anatomy. And it's not because we think that anatomy is the most important topic, but we want to get our students ready for that M1 year. Medical school, even for a really talented student, is a little bit of a shock. The information comes quickly, and so we've got a quiz every day. There's a test every week. The first day of class is not exempt from that quiz, and so we expect you to be working hard right away. By putting it at the beginning of summer, we let students become acclimated to that, and then they do better when they hit that first rotation. So that's kind of my take on what we do here in Nebraska, but also a little bit of a broad view of what I think a lot of programs do.
Okay, thank you very much. It seems that there are a lot of options in most of the MD PhD programs, and also Dr. Mott just reminded us that you should figure out whether you fit into the program before you get into it. So that actually comes with our next question. What are distinguishing factors that separate exceptional candidates? What kind of activities would you recommend to an undergrad student who wants to apply?
So maybe I could start off the conversation given the fact that I specifically oversee our admissions process here at UCSD. We interview a robust cohort of students. We get on average about 550 or so applications per year. And we tend to interview around 10 to 12% of those applications. And so we are exceedingly selective in those that get an interview. And then ultimately the number of people that we're able to accept and matriculate into the program is, a smaller fraction of that interview cohort. And it varies by year depending on the support from the university and the number of students that we've taken on a 3 or 4 year moving average. What we end up looking for the most, I think, are 3 key qualities in our applicants. The first is a drive and a desire to be independent scientists. So you can display that in any number of ways, but I think most of our successful applicants show that they have done both undergraduate and post-baccalaureate research in settings where they were able to really drive their science. If you're just simply going along for the ride, or you were an undergraduate that was quote unquote like working with a graduate student or postdoc, we're really looking for people to lead. And so that's not necessarily the model that we want. We're also interested in people that have had several longitudinal experiences. So have you been in multiple settings where you've been able to test yourself and your research abilities? Because graduate school, especially in a compressed amount of time, will cause you to need to be as independent of a thinker as possible in a wide variety of areas. And I think the last thing that we value many things, but the third thing that I will highlight is empathy. Someone who is really passionate and empathetic for this career choice and really lifestyle choice, because it's a very long training program. Even though it's condensed in many ways, you are certainly dedicating yourself to this, and we want to make sure that you can articulate that. We have had many very qualified applicants on paper that when they come to interview simply are not able to articulate why they want to do this training program. And so it doesn't really matter at that point what your MCAT score is or your GPA. If you can't tell me why you have this fire in your belly to do this training program, it doesn't matter. We want to make sure that you are successful and get all the way through the training program. And it's a long slog. And so we don't want students that may at some point leave the program. And so we're really looking to train those physician scientists in that manner. So I often say the one thing that I can't teach is motivation. So I think that third thing that we're looking for are highly motivated students.
I think that was really elegant answer, and I totally agree with all those points. And then I think so the second part of your question was what activities? So that's a good thing. You know, as an undergraduate student, you can't go out and do what MDs do, but you can go out and do what researchers do. So get involved. And if you find that you are curious and that you'll come back after you're tired from class or whatever, and you're going back to lab because you just want to know, that's a great prognosticator. If you're like, take it or leave it, pay attention to that, because that, you know, that'll mean something, because it's real, like, you know, like Dr. Engler just said, it's really about independent drive. And if you love it, you're gonna know, and I think that'll be the best thing you could do as an undergrad, to figure it out, and then it'll materialize into all those things that admissions panels look for.
I think there's a flip side to this question. There's a feeling that there is a secret checklist that we're looking for. Have you met this number of hours in this particular environment, in this particular role? Some of that is not wrong. We need you to show that, yes, you're invested in medicine and you're invested in research. And to do that, you have to kind of explore both of those careers a bit. What I would say is the student who shows me that they are invested in what they're doing, there's a long-term ongoing activity. That's the student who stands out. Somebody who has, 200 hours of clinical shadowing, oh, that's huge. That's way more than we're looking for. But if it started and stopped in the same year, and that year was 2018, I'm not convinced that you can't help yourself but go back. And that's kind of what I need, is somebody who can't help themselves but to engage with both medicine and the service in some way to a patient population. You don't have to be shadowing a physician every time, and with research. And so show that you're doing what you want to be doing, and that also matches up with the training goals in an MD PhD program. I think that if you think you're doing something just to check a box, a lot of the admissions folks, we're going to see it. We're going to notice that you've checked that box and then you didn't go back to it because you didn't like it. And that tells you a lot about whether you should be pursuing this training.
Yeah, I mean, I think that, this is a kind of a labor career of love, right? You have to really love what you're doing. Like, I think I say this all the time, like I absolutely love my job. Like I can't imagine myself doing anything else than what I'm doing. And so I'm just, and you get to kind of enhance that experience in every way as you kind of get older. Like you get to pick the things that you love to do, and you just keep rounding and molding this career into something that just makes you excited. But that's not to say that it's an easy career. In fact, you know, an MD career is incredibly challenging. A PhD career is incredibly challenging. Put them both together, it's incredibly challenging. And some of the most challenging parts are just that, you know, stuff just doesn't come easy, right? I mean, you know, you go to the hospital, you fall in love taking care of patients, and some will live and some won't. That's hard. You work in a laboratory on a grant, and you think it's the best ideas that you ever came up with, and it doesn't get funded again and again, or you submit a paper again and again, and you can't get it, you know, published in a place that you want it to get published. I mean, this is part of daily existence. So, you know, a huge part of this career is a sufficient level of love and confidence in what you're doing to persist, and then a level of resilience that you can kind of adapt to what happens to you and your thoughts and your patient care and your research interests, you know, as the career goes forward, because you're constantly going to have to absorb hits. You know, it's not all going to come easy. It actually comes hard. And so, you know, in the admissions process, you're really looking for people that are just beaming about what they just can't wait to start doing. And so, and that's just a genuine, and Robert mentioned empathy. It's just like a genuine aspect of people that comes through when you meet them for the first time. And so, you know, that X factor of like just convincing someone during an interview that this is a genuine love that you have for what you're about to do and you can't wait to get started. I mean, I think in terms of the activities, you know, there has to be a clear commitment to really caring about other people. You know, and that doesn't necessarily, that could come in the shape of shadowing, and that could come in the shape of volunteerism. That can come in the shape of taking care of your brothers and sisters. You know, it comes in very many different, you know, flavors, but showing that you really have a care about other human beings is a big part of it. Other orientedness, you know, this is probably the least self-centered career that you can possibly pick. You know, it's really all about what you're doing, you know, immediately for another person in the hospital or in the clinic, or, you know, for much larger others, people in the context of the impact of your research potential. So, and of course it comes along with top scholarship and grades and MCATs, and, you know, and as, you know, Justin and Adam mentioned, you know, deep dive, long-term commitment to things like your research, you know, not a lot of superficial skimming of the surface, right? Like really just getting down in there and seeing what it's like to know that that's what you want. And then of course, you know, we love to learn about special talents, you know, people that are multidimensional, multi-talented. Think about it, like we're putting together a class, you know, that really becomes a family. And it's really fun to have people in that class that are, you know, world champion javelin throwers, or you know, top-notch violinists, or writers, or artists, or have special talents. You don't have to be like the NCAA, you know, winner, but if you have a passion or you teach those sports, or you teach the music and engage in interesting activities, that really kind of sparkles as well. But it's all the same thing, right? It's showing passion and love for what you're doing because it's just an innate aspect of your person. And so, you know, those types of things really shine through in person. And what you have to try to do in these written applications is to somehow get it across in words and text. And I always give advice to say that, you know, you should really take the time to give your writing to someone that really knows you, like your best friend or your sister or brother, and ask them, you know, is this me? You know, is this writing? Is this paragraph, this essay, you know, is this me? Did I convey me in this? And if they're not quite sure, then you have to kind of go back and make sure in this written application that you're really leaving a piece of you in that application so people can really understand what you're about. Okay,
Thank you very much. So it seems that we have a few participants in our panel now. We'll move on to the Q&A section now. And in order to ask a question, you can use the raise the hand button under the participant tab. And if you don't have that, you can use any other signals so that we know. And I'll hand it to Basha, who will be the host for Q&A.
Hello. So if you have any questions, feel free to drop them in the chat or just unmute yourself. So I have some questions that have been directly messaged to me, so I'm gonna ask them right now. One of them is, how has COVID-19 changed your program, both for current students and prospective students? Have any of your expectations changed for applicants?
So maybe I could answer the admissions part and leave the other parts of the question to other panelists. For applicants, we are certainly very sensitive on the level or on our expectations for how thorough someone has been in experiences with respect to clinical shadowing or any other volunteer work that they're doing to show their level of empathy and connection with patients. Same goes for research. We understand that doing research in person is very challenging right now. Basically, none of the undergrads that would work in my lab on a normal daily basis are there. So where people are able to seek out virtual experiences or work in sort of a computational area, that's great. But we are certainly cognizant of that. And so we have dealt with that by not relaxing our standards, but being more flexible and empathetic to the needs of our applicants. And so when evaluating them this cycle, we looked for people that were trying to do things in the context of an online environment, rather than expecting that they have a tremendous number of, say, peer-reviewed applications that they've been working on or have published already. Because we're generally looking at a package of someone over several years, so both undergraduate training and perhaps some post-bac training, we certainly did still expect that someone had some time in the lab, but we didn't necessarily have the expectation that it would be continuous and that they would be in the lab setting right now. So I think that we have certainly been a bit more flexible when it comes to how students demonstrate their independence in a research setting and their clinical exposure too.
Yeah, I mean, there's no question that this is hard. Unprecedented is the most overused word now for the past 12 months. I mean, there's no other way to say it. And so I think at the end of the day, it just comes down to common sense. And, the good news is that your colleagues who are applying are all pretty much in the same boat, unless they're coming from New Zealand. So, it's a common experience across all the applicants. So I think that should make people feel like that not any particular applicant may be in a particular disadvantage, but that's also not universally true either, right? Because some folks are in parts of the country where, they may have more access than others, or there may be, like circumstances that are harder than others. We've certainly seen applicants who were unable to go in person in a lab even when they had the opportunity because they were worried about coming home to, a loved one who is at home who may have been immunocompromised or have other, high risk factors. So, but, a lot of the applications now have a box where you can say, how has COVID, affected you? And that's where you basically just explain what the real, life experience has been around dealing with this pandemic. And you're certainly not going to be alone because everybody has had, so many challenges with this, whether it be health, mental health, financial health, everything, you name it. I mean, I have two or three of my sons are in college right now. And, so I've seen firsthand, how it affects what they were able to do and what they were not able to do. So I think people are very sympathetic and understanding of this. And yet, on the other hand, it's remarkable to see the creativity and ingenuity that some of these students, pull things together that you would never have expected they could pull off. So, on the other hand, there's a lot of creativity, getting back to that resilience concept of like, how am I going to push through this and make the best of it? And many students really show that in a very impressive way.
So,
go ahead,
on the ground here, I'm sorry, go ahead, Yadra. On the ground here in Nebraska, each student has been affected differently. The students who are doing studies that involve clinical trials actually had very different challenges than those who were in the lab, wet bench. We shut down most of the labs. There wasn't an absolute shutdown. And so if you were already associated with a lab, you could come. And this is for Nebraska, and I know each state had different conditions. But if you were joining a new lab, it was a little bit harder and rotations became virtual. The challenges were very real. And I think what Lauren said is right on the mark, the creativity that came out of that, and also the demonstration of empathy that came out of that. Just the volunteering that we saw students do, the way that they engaged when they couldn't be on campus. It really was remarkable. And so as you're thinking about what you did you engage your creative side? Did you engage your empathy side? Did you engage both of those? Put that onto the page and make sure that comes through, because that's why you're looking at this possibly as a career. This is the hardest year ever. You are looking to graduate or looking to progress your career during a pandemic. And it's been hard. It's been hard on each of us as program directors and associate directors and mentors. The number of people that I meet with who are in a difficult situation is, is magnified manyfold.
Yeah, I was just going to chime in from a student perspective. It's so nice to hear from the directors that that you guys are asking that question on the application of how has COVID-19 affected you. That was a big concern for me, is like, how will future students, be looked at? So I'm glad that that is one space that students will have the opportunity to kind of explain what's going on. And I think I'll just echo that, like what everyone else is saying, that, there's two sides to this. One is that some of us will be more affected by this than others, but the other side of it is that those who are affected have often risen to the challenge. And I think we're all, especially when it happened to me, I had just started clinics in medical school for the first time. And, you can imagine that all of a sudden you're like, wait, can I see this patient? Can I not see this patient? We're like, do we get N95s? Do we not get N95s? We were told to go off of rotations for a short period of time. It was a crazy transition for us as medical students going through COVID. And I give so much credit to administrations and a lot of the MSTP advisors that are here of, handling administratively the challenges that come with leading students who are in clinics, but also doing graduate school and, working through regulations of labs, but also regulations of hospitals. And it was a big challenge. And I'd say overall, looking back, I'm very thankful that I got to be a part of something that is a once in a lifetime experience. I don't think any other medical student will ever have the opportunity to start clinics in the middle of a once in a 100-year pandemic, So it was a very unique experience. And I think I learned a lot. And I think it's something that I think, like many of us, we kind of took it in stride, and hopefully we're able to see some positives, but also, overcome the negatives.
Thank you so much. So our next question Thank you so much. So our next question from the audience, I'm going to put it in the chat. How does an MD PhD give you an advantage in career in translational medicine over just an MD or PhD?
Well, I have to jump in immediately to say that the most important lesson that hopefully will come out of this session is never say just an MD or just a PhD. That's a life lesson to emblazon in your mind as a future physician scientist, because you never want to be caught saying that, because all of these professions are incredibly intensive. So I always kind of joke when I say that, but I'm not really joking, because you really have to be careful about using that just word, because there really isn't anything that any of those folks do that's a just. But to answer the question, I think that it's not really an advantage. I don't really consider it, as this is this provides you a superior platform to the other category of folks who pursue an MD or a PhD. I think it's all about what you do with it, right? So there are certain things that you would do as an MD PhD, where having both degrees together provides you a platform for achieving a goal. So for example, if you're committed to drug development, You could become a PhD pharmacologist and chemist or chemical biologist and spend your whole life on drug development. If you're an MD who really wants to work on drug development, you could spend your whole career as a clinical trialist and putting new drugs into patients and deciding whether they work or not and being part of these large studies. If you're an MD PhD interested in drug development, you might be a chemist, and a physician in a particular area, and really drive your own chemical research and basic science research in your lab based upon the patients that you love, and have what you see in the hospital and in those patients drive what you do in the lab and vice versa. So I just see them as, certainly complementary careers, but I think, the idea of combining them is really because you need something from both to do eventually what you want to do.
Thank you. Do any of the other panelists want to jump in on that, or should we move on to the next question?
I can add just a quick comment on it. Sometimes it puts you in, gives you a unique opportunity to see both sides and ask the right question, which sometimes doesn't even have to be a complex question. It can be a simple question. One of the things that I'm doing is something that came up when I was on call. One of the, was a patient with head and neck cancer who was asking me, I rounded on him post-op day 1. He's fine. And he's like, hey, what do you think about this neoadjuvant immunotherapy? So you get it before your surgery. And I was like, well, I think it works. We have some data. What do you think? And he's like, well, I don't know. They offered it to me, but no one could explain to me how it works with surgery or radiation afterwards. So I said no. And I said, well, you're so right. That's such a basic question. And that's what I spent the last 1.5 years working on. Did that not occur to, a tumor immunologist with a PhD? Probably, maybe it did. How about an MD? Sure. But just being in both places, going from call back to the lab, I was like, oh, I'm going to model that in the mouse and work on that. So sometimes you just get a little bit of insight from both worlds.
Yeah, I always want to add a quick example to that, because I remember when I was, in the younger stages of this as a fellow, I asked one of my, mentors, who was a very famous scientist here, why he still saw patients, because he's one of the, he's a full professor. A lot of full professors eventually stop seeing, patients because they get so busy with their research. And he was sitting in the clinic, 1 day a week, supervising fellows, taking care of oncology patients. And I said to him, why do you still do this? What about this is important? And he gave me an example that he was, one of the things that he did as his enjoyment was, while the fellow was seeing the patient first, he would flip through the chart, back in the old days when you had a folder. And in the back of the chart, there was the genetic profile of the patient's tumor, what translocations they had or what chromosomal abnormalities they had. And when he was doing that once, he recognized the translocation that he studies in melanoma, and that he actually discovered in melanoma. And he saw this and he's like, oh, this must be a melanoma patient. That's odd. There's not a lot of pediatric melanoma. And then he looked and it was a renal cancer patient that had a very unique pediatric kidney tumor. And lo and behold, he put, these two very disparate things together, that this very rare kidney cancer was seemingly driven by this, melanoma transcription factor. And then sure enough, he went back to the lab to study it. And that translocation ended up being a pathogenic driver of this rare kidney cancer. And that's like another example of what Robert's saying. We're like it's the old Woody Allen, I think, film, like being there, just kind of being there and experiencing, both cultures many times, causes the sparks that lead to new discoveries. And that is definitely an advantage, I think, of having both degrees and working in both environments.
I actually have a question. So, in terms of your MD, PhD, and perhaps just like your MD program at your school, how are they related? Like, do students in both programs work together and take classes together, or are they two kind of different paths that the students are separated in?
I can try to take this one. So for me at Baylor College of Medicine, I would say that you kind of feel like you're sometimes juggling both. But for the most part, when you're in med school, you are a medical student with all the other medical students. So you are literally in the same curriculum. You're pretty much doing exactly the same thing. The only extra things that I would have to do are related to the MSTP program itself. So sometimes you go to extra events or seminars or research talks. But for the most part, when I'm in medical school, I was often very much encouraged to not get involved in too many extra research, extracurriculars or something, and just focus on medicine, because it really, as you kind of heard from the very first question that was asked today, you have to learn to compartmentalize this information, because it is a lot of challenging information to go through and stay on top of. And then similarly, once I got to grad school, that transition was, pretty much, I'm now focusing almost 95 to 100% of my attention on graduate school. And so that means that I was a grad school student with all the other graduate students who are part of the program. And unless you ask me, are you an MD PhD? Or I say it, most people wouldn't really recognize that based on my day-to-day life. So when you're a student, there really isn't a lot of, overlap in terms of like, oh, I'm doing clinics and research all at the same time, unless you want to take some of those roles on, and you're really encouraged to really focus on the MD and then the PhD. So that way you can get the most out of your training in both areas. And then later on down your career path, you can learn to, collectively combine the strengths and weaknesses of both of the, or mostly the strengths of both the MD and the PhD, and then see how you want to utilize the skills you've learned in those 8 to 9 years and take advantage of everything you can.
One of my classmates, I think he was a year behind me in St. Louis. He summed it up really well. So we were bringing in somewhere between 0 and 4 MD PhD students a year. And he said, I feel like a foreign object. When I'm in medical school, my classmates are not sure if I'm the same. And when I'm in graduate school, my classmates are not sure if I'm the same. And I always feel a little bit left out. I have to tell you, that drives a lot of what I do as a program director, to try to make sure that that does not happen. Because if you, Yadra, I completely agree with you. If you fully invest in that training program that you're in at the moment, and you work with your colleagues and you network, these are going to be the future people that you work with, whether they were in your program or not, and whether it's medical school or graduate school at that moment. So, so there is a risk of feeling like the other, or of the one who's not the most common. That risk goes down a bit in the larger programs where you've got a lot of colleagues, but it never quite goes away, because even in a program that has a lot of MD PhD students in it, you will find that you're the only one at some point or another. I'm certain of it. And so not thinking of it that way, not thinking of it as a separate thing, but as two parts of your own career path, I think is important.
Okay, sounds cool. I also have a question. What does translational medicine mean to you?
Means being able to combine everything I'm passionate about into helping patients. It's as simple as that. I think that a lot of us on the panel will say that, between our MDs and our PhDs and everything that we're passionate about, it at the end of the day, it all matters only because we need to take care of the patients that we care so much about. So translational medicine to me is being able to have that humble opportunity to combine things that I personally care about, and then being able to help other people because of it.
Okay, thank you for that. A question from the audience is, can you do your PhD and MD at completely unaffiliated schools, or can you only do it at the same / affiliated school?
So the dual program part of its job is to integrate these two. But to be honest, the very first people who trailblazed through MD PhD training did so because they couldn't help themselves, and they did it and the best training environment for that particular topic. And so it was much more common, or at least you know, almost an expectation that they were at different institutions for the folks who sort of did them separately. As we've started to integrate programs more and more, there's going to be some kind of a partnership between institutions, even if it is at a different institution. In Omaha, I don't have a lot of other institutions, so I will turn this over to the folks who've got a lot of programs in their city. We certainly have students who do their PhD down in Lincoln at UNL, across town at UNO, and also at a research institute here called Boys Town. And each of those has strengths that we might not have here on campus. Finding those strengths and matching them to your own drive is important. And then having administrators and people who've thought about the challenges of getting integrated backwards and forwards into that program. That's what the dual degree program is. We work a lot on that.
I think I've seen some people do sort of do it in different pieces where they do like a PhD and then go for med school. That's certainly a way to go about it. However, if you know you want to do them both up front, maybe look for a place that has it all integrated with an MSTP, because you know, usually people start in their 20s and 8 years, and you're in your third decade, and stuff happens, and it's nice to not have debt that you would not accumulate if you go somewhere that it's all integrated and you're plugged in and you have a training grant for it. But you know, sometimes it can't be helped. But it just to think about that.
I might sort of answer a different question here that Robert brought up. This idea of being funded is really important. The distinction between the MSTP and the MD PhD, they're same or similar, but very often the funding is quite different. And for the MSTP, you know that it is that it's a given. You know that that's a part of the program. For the MD PhD program, for my program, every one of our students is also funded from entry until exit, till graduation. They have the stipend, they have the tuition waiver. That's not always true. And each of the schools that does it without NIH funding has their own approach to it and their own source of money. And so finding that out, asking that question is important for you as a student, because I agree, we go into this because we want to be creative and we want to help patients, but the amount of debt and the number of years, if you have to do these independently, becomes a barrier. And so let the programs support you and sponsor you and invest in your future success. Agreed.
Thank you very much. So we're nearing the around the end of the panel time. So does anyone have any last minute questions before we wrap it up? Okay, thank you everyone for coming. Thank you so much to our amazing panelists. Thank you to our panelists for answering all our questions, and it was really an insightful time. So TMD, we have other events. In 5 minutes, we have both our second speaker session, and we also have industry demonstrations. So if you are interested, please feel free to join those Zooms.
Thank you to the organizers. Take care.
Thank you all.
Thanks for having me.
Bye, everyone.
Thank you.